This is KTVO's Good Morning Heartland.
And welcome back. February is Children's Dental Health Month, and teaching your child good oral hygiene habits early can lead to a lifelong healthy smile, but sometimes that's easier said than done. This morning we have Dr. Liz Kaz joining us once again to break it all down for us. How are you doing today?
I'm doing great. How about yourself?
I'm doing great. Thanks
Good.
for stopping by. So February is Dental Hygiene Month for kids.
Yeah.
And, you know, sometimes it can get really difficult to get your kids to brush their teeth. So first of all, let's let our viewers know what are some risk factors for cavities?
Well, there are some real common risk factors. First of all, if you're living in a community that doesn't have fluoride, non-fluoridated water can actually contribute to cavities. If you use fluoride in your water, you can have a reduction in cavities up to 40 to 60%.
Wow.
So that would be one of the first things, is to determine how much fluoride is in your water, and there's tests that you can get. Say, for instance, if you're in well water areas, there are opportunities for you to have that water tested. And generally, all the products will have fluoride in them as well. Frequent snacking of carbohydrates. You know, when you mix a carbohydrate or a sugar with bacteria, and everybody's got bacteria in their mouth, you produce an acid, and that breaks down the tooth surface, and that's how you get a cavity. High sugar beverages, you know, that's probably the #1 problem, is that that's so readily available and children have access to that. And probably the biggest thing for little kids is never to put your baby to bed with a sugary fluid beverage in their bottle.
Okay.
That's a lot of times how a lot of cavities will start for little kids.
And something interesting that I didn't know about is, even though you know, obviously we have baby teeth when we grow up, keeping those healthy is just as important as grown-up teeth. Why is that?
Well, the primary teeth, or the baby teeth, actually maintain the position for the permanent teeth to come up into the mouth. If you start losing teeth early as an infant, teeth will naturally start erupting, and what that does is cause misalignment of the teeth, and then that can actually contribute to cavities, because it's much more difficult to brush and clean crooked teeth than it is straight teeth.
All right. Now let's talk about kids' products when it comes to toothbrushes and toothpaste. Obviously, we have the kind that, you know, that are obviously geared towards kids, whether it's, you know, the blue toothpaste or, you know, the fun foamy kind, the different flavors. And I just asked you if this is actually safe for kids, and you say yes.
It is, it is. One thing I would caution you, that when you start looking at all the different products out there, really look for things that are name brand, because one of the things that the name brand products will do is ensure the efficacy or the use of the fluoride. It's not going to be outdated, and so you're really going to get the effect of the fluoride with using name brand products. And you can see I've got Oral-B, Crest, we've got some Act Rinse here, I have some Sparkle toothpaste right here. And the other thing that I want to point out is all the different types of toothbrushes that are out there available for kids, and they're so cute. I just love them. They've gotten into a lot of research in terms of the design of the handles and that sort of thing. And I don't know if you can come in really close, but right here on the center of this brush, there's like a little different color there. That's where you're supposed to place your toothpaste, and you only put a very, very small pea size on your toothbrush. You really only need about that much. Normally, if you see commercials or whatever, they really glob it on like that. You do not need that much.
Okay.
So that's one interesting thing. And one thing too, look at the packaging of your toothbrush, because you'll see that it comes in different sizes. And on the very back side, it will tell you what age group the toothbrush should be used for. So they've got some really neat, innovative, and obviously a lot of the marketing for kids is out there.
What about you know, the battery operated ones? Are those safe for kids?
They are.
Okay.
They are.
Okay.
The main thing with all of these products is that they're monitored by the parents.
Okay.
You know, kids really cannot, they don't have the manual dexterity till about age 7 to really be doing it on their own. So the real goal here is to have them brush and then you brush. It's kind of get into a pattern, so that you know, you're really modeling good dental hygiene and oral care for your child. And you know, the recommendation now is by age 1, you should have your first dental visit.
Okay.
So.
All right. Well, thank you so much for all this information. Obviously, it's
course.
very important. And what we'll do is we'll post everything on our website at heartlandconnection.com.